alikuwa moyo wake ulikuwa unaenda mbio, anaumia, analia. Alikuwa anahangaika sana kwa hiyo kupumua, kwa apata shida kwenye. Tunashukuru madaktari wako vizuri, wanaangalia watoto, wako makini. Tunashukuru kwa huduma zao.
It all came actually as a thought. Me and a friend, a pediatric cardiologist, he's an Egyptian cardiologist actually, who was living in Jeddah, Saudi Arabia. I mean, we saw how much referrals we were getting in Jeddah from the countries around us in Saudi Arabia, namely Syria, Egypt, Sudan, Yemen, all these countries. And at one stage we said, you know, they cannot just keep coming because it's difficult to travel. Why don't we start going there? We started by doing 2 missions a year, went up to 3, now we're doing 4 missions a year. Each is 1 week. We do about 65 to 85 patients per mission. We target all poor countries with poor pediatric cardiac services. So we went up to Kazakhstan, up there, went to Yemen, went to most of Africa, Egypt, we went to Syria before the war. In countries like Tanzania, Sudan, and areas where pediatric cardiac surgery is so much lagging behind, you'll see all these late presenters. I mean, these patients in the UK or in the US or Canada, they are done between age 4 to 6 months old. In Saudi Arabia, we do them between age 6 to 8 months old, so all before the first year of life. Here, all the ones we're operating, their age is 3 years, 15 years, 21 years old, tetralogy. It's amazing.
The benefits which we are getting with the visiting teams, one, you should understand, our waiting list is long. You are talking of 500 patients in the waiting list by end of December of last year. So we started with a bank of 500 patients. Two, majority of our patients, I can say 70% of them cannot afford to pay. But the third, which is the most important thing, instead of sending one doctor or one nurse to go and study abroad, when the teams come here, we can have a mass training of 5, 6, 10 doctors at the same time in the theater or in the cath lab. So it's really an ongoing process. And when they leave, some of the consumables which we didn't use during the mission, they leave them behind. So our team also can boost with what we are getting from the government and the revenue the institute is generating. We can afford to continue and serve those ones who cannot pay.
Alikuwa anahema haraka. Huduma hii tunamshukuru Mungu, kwa kweli wamemfanyia vizuri na anaendelea vizuri, hamna tatizo lolote. Yaani nilivyomuona hivi nilimpeleka hospitali, nilianzia hospitalini, nikaja nikaelekezwa nikaja Muhimbili. Ndio tukawa tunahudhuria kliniki.
The families are really appreciative. But then toward the end, when you start, to close the mission and you still have some people left on your list and you cannot help them, you just tell them, we'll wait for the next mission or wait for another mission. So it's a little bit emotional, toward the end, because you cannot help everybody, but you try your best, you work. And the guys here are really working like 10, 12 hours every day just to catch up with as much as they can do.
It's a mega team. As you can see, there's a large number of expertise and a lot of resources as well, so it's more like a flying hospital or a flying cardiac center. And it's just a great feeling. It's so gratifying to know that we can do these complex procedures in different areas if you put the right team together. Part of the challenge is that a lot of people have been missed for so long or haven't had the chance to get access to healthcare, so they're really delayed. And the human body is not built to sustain low levels of oxygen for a long period of time or too much volume load to one side of the heart for a long period of time. As a matter of fact, yesterday we had a patient who was supposed to be operated on in the first month of life, and he was 14 months when we did his surgery. That's one of the challenges. We get sometimes challenging times with bleeding because the blood bank is somewhat limited in what they can offer. The population of Tanzania is getting close to 60 million, and by talking to the local physicians, this is the only center that offers open heart surgery in Tanzania. Not in Dar es Salaam, the whole country, this is the only center. So obviously the demand is much higher than what the system can offer.
I like this profession. When I work with humanity, it's a good job. Yeah. It's a good job. I feel comfortable. I'm doing for the humanity. When I started my education in Children's Hospital, he was comfortable. So now I feel also comfortable, more comfortable with the kids. And I like when they are smiling, I can make them happy. I didn't feel any difficulty and emotionally because I know I'm working for their health, for their better. So I should not be emotional.
Usually patients will come from the OR immediately post cardiac surgery to the ICU, and they will stay between 2 to 4 days in the ICUs. It's a really very crucial phase where you need to manage the patients and get them extubated off inotropes, and then they will be evaluated to be transferred to the floor. And this process sometimes, as I said, takes from 2 to 4 days, depending on the case and the diagnosis and the surgery. It's very important for us as a human to help each other, and especially when you go to countries, poor countries, where they don't have this service. So basically, if you don't this surgery, they will die. And from our deep inside, if you save a life, as you save all humanity.